Assalamualaikum warahmatullahi wabarakatuh. Hi guys, as you all know, I'm Bella and I'm a student of nursing at University of Muhammadiyah Semarang. Today I'm going to be talking about tuberculosis disease. Yes, maybe someone already knows what is tuberculosis, but in here I will explain in more detail and how they affect you. I'll begin by the definitions. Tuberculosis, or we can call TB, is a potentially fatal contagious disease caused by Mycobacterium tuberculosis that can affect almost any part of the body, but is mainly an infection of the lungs. And then I'll go on to epidemiology. Did you know, based on epidemiology, more than 7.1 million new cases of TB, all forms, both pulmonary and extrapulmonary, were reported to the World Health Organization (WHO) in 2011. There are 95% of cases were reported from developing countries. And you can see in here, on year 2011, India is in the highest position on this case in world, while Indonesia is in the fourth position in the world. And lowest position is Cambodia country. So the total TB cases in the 22 high-burden countries is 7.1 million people. Do you always feel that your body is fine? Relax with surroundings without regard to clean and healthy living behavior? You cannot underestimate it, just like appear anywhere. Here I will understand about tuberculosis, which is one disease that is quite dangerous if not realized early on. I have in short stories. When I practiced at Wongston Memorial Hospital, I was placed in an isolation room. There were many patients with tuberculosis. I was quite concerned because the family was given restrictions when visiting patients to prevent transmission. Can you imagine how sad it is when one of your family is a patient there? Therefore, it is very important for us to know the symptoms of TB disease. There is coughing, cough with blood, fever, fatigue, weight loss, chest pain, chills, night sweats, and feel hazardous. Next, I'd like to move on and discuss about risk factors of TB. First, close contact with someone who have active TB, immune-compromised status, elderly, cancer, drug abuse and alcoholism, people lacking adequate health care, pre-existing medical conditions, GM, chronic renal failure, immigrants for countries with higher incidence of TB, institutionalization, long-term care facilities, living in substandard conditions, occupation healthcare workers. Next, I'd like to talk about the nursing management. 1. Assessment. 2. Obtain history of exposure to TB. 3. Assess for symptoms of active disease. 4. Auscultate lungs for crackless. 5. During drug therapy assess for liver function. Finally, is nursing diagnosis of TB. 1. Ineffective breathing pattern related to pulmonary infection and potential for long-term scarring with decreased lung capacity. Interventions: administer anti self-administration and of medications ordered. 2. Risk for spreading infection related to nature of disease and patient symptoms. Intervention: be aware that TB is transmitted by respiratory droplets. 3. Imbalanced nutrition less than body requirement related to poor appetite, fatigue, and productive good. Intervention: explain the importance of eating nutritious diet to promote healing and defense against infections. 4. Non-compliance related to lack of motivation and lack of treatment. Intervention: educate patients about etiology, transmission, and effect of TB. Okay, thank you for your attention. From me, wassalamualaikum warahmatullahi wabarakatuh.